Hi, it's Christine McDonnell and I'm here today to talk to you about how long menopause does take. So, how long does it take? Well, the menopause is a signal that the body is reaching the end of its fertile stage. It's defined as occurring when the ovaries cease to function by releasing eggs and menstruation is ending. How long menopause takes can vary between individual women and it's difficult to predict. Some women experience menopause for just a few months, while other women experience it for many years. 3 to 5 is the average, but some women it can go on for up to 10 years. Perimenopause can last for 4 years prior to menopause, so it can feel like it's just going forever. Perimenopause is where the hormones are declining and you start to get symptoms like mood swings, difficulty sleeping, hot flushes, irregular periods, light or heavy bleeding, and anxiety and irritability. Perimenopause can begin for some women in their 30s, but commonly it's usually in the early 40s. Although the menopause is not officially diagnosed until there's been an absence of menstrual periods for a full 12 months, many women experience symptoms after this. There are a number of simple lifestyle changes to diet and engaging in regular exercise which can provide relief from menopausal symptoms. The menopause usually affects women in their late 40s or early 50s. However, there are cases of early menopause in women under the age of 40. Early menopause is usually the result of a surgical intervention, chemotherapy, or as a symptom of certain illnesses and conditions. Although there are cases which are related to family history, following suit like your mother did. Recent research has also indicated that smoking could be responsible for menopause occurring earlier than normal. Women who have yet to reach menopause when they are older than 55 are categorised as having a late menopause. There are a number of factors which may be responsible for delaying the onset of menopause. These include being overweight. Late menopause is more common in obese women. This is due to fat cells' ability to produce estrogen and therefore they're holding a lot more estrogen in their bodies. This can cause problem when levels of progesterone are reducing, including an increased risk of developing endometrial cancers. Thyroid problems or disorders of the thyroid can have an effect on the onset of menopause, causing it to be late or causing it to be early. One of the primary functions of the thyroid is maintaining your metabolism. So when a problem occurs, it can affect a number of systems in the body, including the reproductive system. Since the symptoms of this are similar to many common menopausal symptoms, including mood swings and hot flashes, it is sometimes mistaken for the menopause, but usually menstruation does not cease. Naturally high levels of estrogen, some women have abnormally high levels of estrogen throughout their lifetimes. This can cause the menopause to occur later in life. This can also cause estrogen dominance, which can present a number of symptoms and health risks for women. The condition should be treated to prevent long-term illness. Although the menopause is not officially diagnosed until there have been an absence of menstrual periods for a full 12 months, many women experience symptoms after this. There are a number of simple lifestyle changes to diet and engaging in regular exercise which can provide relief from symptoms. A diet which reduces or eliminates stimulants such as caffeine, alcohol, and highly spiced food has been shown to reduce the severity and occurrence of hot flashes. Increasing the consumption of whole grain foods, fresh fruit and vegetables, a Mediterranean diet can have very beneficial effects on symptoms and help avoid weight gain, which is common during menopause. Nuts and seeds can provide several key vitamins and minerals, which can alleviate symptoms and reduce the risk of developing certain illnesses. There are a number of supplements created specifically for menopausal women. These focus on ensuring adequate levels of vitamins A, B, C and E, which contain antioxidants which can relieve symptoms and improve bouts of depression. They also usually contain calcium and vitamin D, which are essential for maintaining bone health and reducing the risk of developing osteoporosis, which becomes more common after menopause. Many women also find herbal treatments helpful in relieving menopausal symptoms and restoring hormone balance. Herbs usually belong to one of two groups, phytoestrogens and adaptogens. Adaptogenic herbs can stimulate the body to increase production of certain hormones, which can correct hormone imbalance and alleviate symptoms. Phytoestrogen plants and herbs contain a hormone which can mimic the estrogen produced by the human body. Your natural healthcare practitioner will be able to accurately prescribe what will work best for you, taking into consideration your total health history. Recent research has indicated that the use of hormone treatments can actually stop the menopause before it can fully begin. Many women are reluctant to use synthetic hormones, however, and HRT is known to have side effects like increasing the risk of blood clots and strokes. You can try bioidentical hormones, which are created to be molecularly identical to the hormones produced by the human body. This ensures that they are well received by the body with a minimal risk of side effects. Bioidentical hormones are created from substances produced from wild soy and yam derivatives. The treatment regime involves compounding an individualised prescription into a specific delivery mode, usually creams or sublingual troches, by a qualified compounding pharmacist. You will need a script for this from your healthcare practitioner. The menopause can be an emotional journey, but there are a number of different options to alleviate symptoms and improve general feelings of well-being. If you feel you may be experiencing any of the symptoms associated with the onset of menopause, then you should consult with your healthcare practitioner. Your natural healthcare professional will be able to establish a diagnosis and provide you with advice and guidance on the treatment best suited specifically for you. For more great advice and natural solutions for menopause and midlife and beyond, click on the link below.